everyone. I want to welcome everybody to our most recent webinar here today as the Colorado ASC Association. For those of you who do not know me, my name is Simon Schwartz, and I'm the Associate Director of the Colorado ASC Association. We are your voice for the industry, both legislatively and regulatorily. Basically meaning when there's any new issues that come up for the industry, we're the first person that goes out and looks out for your best interest. Today, we are bringing forward some experts in the ASC industry, and we're happy to call not only sponsors and corporate members of our organizations, but really, when it comes to resources, they're one of our first go-to calls, emails, or text messages when it comes to what's going on in the industry. Valuation plays an incredible role in how our ASCs operate. Just like any other business, there's a price tag, there's operations, there's every element that's involved, and it does play a critical role. So we really, really do appreciate when someone picks up the phone. We call in Pinnacle Healthcare Consulting as one of those. So we really appreciate Pinnacle sponsorship for 2025, all the years beforehand, all the years coming up. We can't thank you enough for the support that you give, and especially for the expertise. It's incredibly important in the industry. I want to take a minute and introduce our presenters today. We have Anthony Long, who's a partner, along with Zach Mayer, who's going to give us a little conversation about what we need to know for our facilities today. If you did not get a chance in our last newsletter, the Pulse of Progress that comes out once a month, take a look at the bottom area where we have resources. There's an incredible article from our friends and our supporters at Pinnacle Healthcare Consulting, letting us know important areas of the industry. While we get to it, I just want to note for the audience, if you have any questions, please put them in the chat feature, and we will do our best to ask and answer those questions at the end of the session. When we get to the Q&A session, I will pop back in and we will direct those questions to Anthony and Zach respectively. But again, just want to say thank you to the both of you for taking time out today to have a session with us and help enlighten a number of different people, anywhere from C-level executives to the operations and clinical staff. We just appreciate the information that you're bringing along. So thank you very much.
Yes, Simon, thank you very much for the organization yourself having us. We appreciate the relationship and partnership that we have. And so we'll kind of jump in just with background. Zach will share the presentation as we kick off. But so my name is Anthony Long. I'm a partner with Pinnacle Healthcare Consulting, oversee our strategy, operations, cost reduction, and value-based care teams. And this is the team that's responsible for evaluating feasibility of ASCs, maybe performance improvement, or positioning of the ASC as we look at advancing those initiatives across the ambulatory surgery center side. Zach.
Great. Thanks, Anthony. I'm Zach Mayer. I'm a director here at Pinnacle. I work closely with Anthony for our strategy service line, and I have a focus with data analytics. So as we get into some parts throughout our presentation and talk about the quality reporting and different changes for ASCs moving forward, it's something that Anthony and I within our service line, we really enjoy paying attention to and following along, and also keeping track of any upcoming headwinds and what changes in the landscape that all ASC administrators and leaders need to be aware of. But we'll go ahead and get started with the presentation. So today, our presentation we decided was really evolved to focusing on the ASC setting and specifically honing in how the one big beautiful bill will impact CMS, and which will translate to how that impacts our ASCs and how we run and operate them, and strategically think about the future and what would be best for our patients in the ASC setting, and then also just operationally remaining agile, efficient, and providing the highest level of quality of care for patients that are applicable for having surgeries within those settings. As we mentioned earlier, I'm Zach Mayer, a director at Pinnacle. I'm here with my partner, Anthony Long. And looking at today's agenda, we'll cut through the noise on some of the federal changes, especially the One Big Beautiful Bill, and translate what that means specifically to the ASC space in general, and drill into Colorado-specific ASCs. We'll also look at flagging near-term opportunities that our audience can act on now, or just continue to monitor as these changes or proposals to the regulations. These new updates are coming out pretty frequently, so staying on top of that is pretty vital. And as we look at the impact of the Big Beautiful Bill, so CMS provided this statement earlier this year, and I think clarifying that as from a federal standpoint, the One Big Beautiful Bill doesn't rewrite Medicare ASC rates directly, but where it does impact us is it does change the coverage dynamics and Medicaid financing. So what that means for administrators and ASC owners and operators is, we should expect a payer mix drift. If Medicaid eligibility changes on the coverage for any population in a community, how that can impact your ASC, how you can prepare for that, and what to be aware of as these proposals are moving forward. So understanding tighter state budgets and how they can ripple into the commercial negotiations, manage Medicare behavior, and then just keeping all these in mind, how that translates into the 2026 landscape and years moving forward. But at a high level, CMS has released a proposal of a 2.4% payment update for the ASC fee schedule. In addition, over 200 procedures moving to their eligibility moving to the ASC setting. And lastly, at another high-level mark, adding in new patient reporting for quality outcomes, performance outcomes, and what ASCs will have to report on in the future versus historically. Now, when we look at ourselves in Colorado, is, from a healthcare standpoint, we have over 180 ASCs throughout our state. So the impact to federal regulations and proposals, specifically for the ASCs, has a pretty significant impact in our communities. When we look at breaking these impacts and proposed changes and regulations into buckets and summarizing them to what that could mean for us, we look at, again, the funding for Medicare and Medicaid. So Medicaid eligibility and funding, the law tightens the eligibility. It adds in community engagement and work requirements in some cases. It also, there's a tax implication. It changes the premium tax credit eligibility rules. And the bill also revises how a state provider can tax and direct payments, how these are all treated within the state level. Also looking at rural healthcare, there's a focus for within the One Big Beautiful Bill of targeting rural health support. How do we support both hospitals in the rural setting, but also ASCs, funding and looking at like the rural hospital fund and providing protections for the providers in rural communities. Also, from a telehealth standpoint, the bill permanently extends the safe harbor, so telehealth benefits with no deductibles don't break or go against any HS rules, making telehealth for remote and both pre and post-op pathways easier potentially, and also to keep in the previous rules with telehealth, keeping those aligned with the benefits that both the patients and then contractual agreements that the ASCs have. We talked, we think about the impacts that they can also have is changing the case mix. So as these procedures and there's new codes that are being reviewed and thought of what can be eligible and safe in the ASC setting, just understanding that continual shift of cases to our lower cost outpatient site versus maybe a hospital setting, and looking at the payer mix. If fewer as an example, if fewer patients and people in communities are covered, or there are narrower subsidies for these agreements, potentially there could be more patients that are uninsured or on Medicaid with a higher patient cost share, and that could directly impact the ASC's bottom line and your P&L. There is variability by state. So within the One Big Beautiful Bill, there's the structure at the federal level, but then at the state decisions, that can vary across states and how they implement work requirements, how the cost sharing is structured, provider tax changes, and also importantly, how funds that are dedicated for rural areas, how they're used. These will all cause very different outcomes state by state. Rural ASCs may get new grant assistant options, but potentially urban ASCs may not be. So in states that cut Medicaid funding could also, there may be significant revenue pressure for facilities that operate within these states. So it truly can be variable on a state-by-state basis. So understanding not only the legislature and the proposals and structures coming out from the federal level, but translating that at the local level of what will be the ultimate, final view of the state for their practices, facilities, and locations. What does that mean? So it's important for anyone in listening to today's webinar to have a strong pulse on both the federal level, but as well as the state level, and how that can impact you directly where you operate. So looking at a high level for OBB changes into the changes for the ASC industry. Looking at the law and the phase through December of 2026, it will be doubling the redeterminations every 6 months from a Medicaid eligibility, adding 80 hours monthly work requirements. Expect increase in paperwork. So from disenrollment risk, looking at eligibility, and a payer mix drift towards self-pay. These are all areas that from a paperwork and documentation standpoint, there's changes that are coming through down the pipeline. And also looking at the eligibility proof of capture and being proactive on communication with the member messaging. These have all been points that have been cited throughout the bill that are areas of opportunities that the government wants us all to work towards improving and addressing. So looking at additional changes into the 2026 year, looking at understanding the flexibility of procedures that can be performed in the outpatient setting. Many procedures currently done only in hospitals, we are now seeing are being proposed for the ASC setting if it's safe and feasible, and looking into specific flags of the procedure types, how that impacts some specialties more than others. We'll get into that in a little bit. And looking at, how is your ASC structured? Are you a single specialty ASC, a multi-specialty ASC? What are you equipped with today? What can you handle? And from a strategy standpoint, what procedures that may be eligible for the ASC setting that would be applicable to bring into your ASC and provide for your patients. Looking at just what's proposed and these proposals, as we look at the new announcements that are coming out pretty frequently. There's about 276 new codes that are being proposed as added to the ASC fee schedule. When we look at the specialties that are impacted, orthopedics, cardiology, GI, and some others. Looking at ablation, that's certainly a procedure that I think there's a lot of eyes on, both in how can that be done with a safe structure in the ASC setting that is also, from a cost standpoint, lower cost than in a hospital setting, but also is the right choice for both the ASC operator and the patient. Looking at spinal fusions, a lot of these procedure types that we see through these lists have been talked about for years, and that translation and eventual conversion to the ASC setting there are some that don't come to us as a surprise, but there's also, as you look in through the procedure list, some may catch you a little surprise of what may be eligible moving forward in the ASC setting. So again, looking at your current caseload and your case mix of patients and the types of treatments you provide today, what will that mean for you and your team tomorrow on what you can provide for your patients with this as the new CMS code list is finalized moving forward? As we talk about the procedure list and the 200 plus different types of codes that are now being proposed that could be applicable for the ASC setting, how do we go about evaluating and vetting what procedures to bring into your existing ASC, what procedures that, although they're eligible for the ASC setting, may not be the right fit for your ASC? There's quite a good amount of due diligence that ASC operators and owners should take as they understand the new clinical procedural profile that can impact them. Looking at safety and risk, what are the risk of complications for these procedures? What's the ratio of conversion to hospital if the risk is high, and understanding the length of stay, if there's monitoring requirements, and ensuring that your ASC is aligned before taking on any new procedures. Moving into capital and equipment needs with these procedures, how many of the equipment items you have in your OR and ASC setting today can be used for these new procedures? Are there new equipment? Is there updated equipment that's required? Also, payer contracts and reimbursement. So understanding at a revenue and cost standpoint, what will you receive as payment in the ASC setting versus your typical hospital setting? Understanding your specific fee schedules or any contracts with commercial payers. If there's carve-outs, you want to pay special due diligence to those to make sure there's no confliction between carve-outs or any of your contractual agreements compared to new procedures you plan to bring into your ASC. Performing a market share or case volume analysis. Is there demand for these new procedures for your ASC specifically? And then looking into, are there licensure, staffing, or credentialing requirements that are in addition to what your ASC already has in place and your team is already certified for? And looking at a revenue cycle process too, as there's always seems to be challenges as new procedures, new tests, new treatments are brought on. Understanding the RCM process from start to beginning and ensuring that the care that you provide and your team provides for your patients, that you will be able to collect compensation and revenue for that. These are all important things that may not be completely mind-blowing new, but just wanted to put in front of the audience today, having a checklist of, as you and your team are strategically thinking of how to operationalize new procedures in your setting, running through a list like this and checking that box will certainly serve you and your team moving forward, and hopefully avoid any bumps in the road as you continue. And a couple items, again, throughout this process, it's going to be imperative to both understand impacts at the federal level, and then also how, from a Colorado view, what does that translate to for this state specifically? What's in place and recently changed? We do not have a certificate of need program that applies to ASCs. The length of stay restriction within the ASC cannot exceed 23 hours. Also, Colorado requires medical history and physical examination, a record of this prior to the surgery, which aligns with some of the federal changes and proposals that we've seen lately. And then also the changes of ownership for a facility. Historically, the state of Colorado, depending on the facility type, the range could be anywhere from 30 days to 90 days of a notification. This has now changed. All notification between a change of ownership for the ASC settings will now be at the 60-day standpoint. And what to monitor as we continue to move into the new year is understanding what the Colorado Department of Public Health and Environment continues to release and update about licensure rules and any revisions, any inspections that may impact your facility directly, compare to what you're doing today, and compare that with any of the new revisions that are being released. And also within Colorado, it recently revised its rules as far as the surprise billing laws that have been in place, looking at what that means for your workflow, what you need to state on your billing for your patients, and what you include when you submit for reimbursement. And we discussed the change of ownership notifications and what that may mean for you if there's any ownership changes that you predict will impact your facilities and within the next 12 months. Certainly pay special attention to there. And also from a quality reporting and patient record standpoint, Colorado already has, when we look at the procedures and where's the low effort wins for payer credibility, how can you translate from your EHRs the necessary quality reporting that you provide to the payers, and making sure you're keeping track of these types of reports and submitting to the deadlines that are at both the state and federal level to make sure that you are in compliance with all new regulations that are being set forward. And then as we move forward, Anthony will cover the alignment within the ASC space and factors and things for you and your team to consider as you address regulatory headwinds, any changes, but also looking at if there's alignment opportunities that will best serve your team, your practice, and your patients. Anthony will cover a couple ways of going about this and thinking through it of really what's going to translate to the best scenario for your organization. Anthony?
Yeah, thank you. Thank you very much, Zach. So as we go through, I mean, I think the big takeaway that Zach covered both on the federal and on the state level is that there are impeding changes that are a result of the big, beautiful bill, but also just changes that we're seeing in the state as a result. So I think being mindful of how are we working with our physicians across the ASC setting, how are we preparing for the correct mix of procedures that are going to be provided, how do we incentivize those efforts? So obviously there are distributions and there's different categorizations that we can talk about. What we're going to talk and shift our attention to, though, is our 2 alignment models that are active across ASCs. One is kind of an old concept. Zach, you can flip the slide, where we talk about gain sharing. And that is utilizing a format by which we evaluate cost reductions. So specifically physician preference items that we're using in our ASCs to really drive down the cost of that in those efforts. You do have the ability to participate with multiple specialties, multiple groups, and identify what those savings could be across your organizations. With an ASC setting, we do look very carefully to make sure that there is enough savings that it will generate enough on a per physician basis to really support those initiatives. When we get in the Q&A, I'm sure we'll talk about a topic that comes up frequently, and that is just overall ASC governance and how do we leverage the governance aspects with addressing some of the changes in the regulatory side, and then looking at sharing some of those savings back with our individual providers. From a gain share perspective, it is important. There are very specific rules as to not just making up what those savings are, but rather looking at an organized format to demonstrate and value that. When we look at some of the regulatory changes that are proposed, this also fits nicely into trying to identify and supporting those initiatives around savings back to payers and back to patients. So as we look at both, that becomes important to really understand the differences in the overall surgeon profile and how those surgeons are practicing at your individual ASCs. So again, very clear rules, but is an area that we see as an opportunity to work with your physicians. We'll then transition to the next slide where we talk about value-based enterprises. VBEs require really 4 activities to be followed in order to elevate and share. This is kind of a growing, it's a new rule that went into effect in 21. Most VBEs did not really start operating until later in 23, 24. Some are under organization and structure today. You start off by identifying a value-based purpose. So what am I trying to resolve? When you look at some of the new roles and the new models that are coming out, the fact that they've introduced the patient reporting and patient outcomes into some of the new regulations, kind of elevates the need for us to say, how do we work with our align our physicians into consideration? So how do we identify that value-based purpose? What are we trying to solve for? There's a lot of focus on back care, a lot of movement, obviously, with spine cases continuing to, in just the overall MSK environment, continuing to expand in our ASCs. So how do we incorporate some of those rules that are coming out from the federal government across our ASC environment to just have particular focus on that? We do look at value-based activity. So if I do something to elevate value-based purpose, how am I proving that is carrying through to our setting and into our care delivery models? That can be something as simple as care management all the way up through and including the procedural outcomes themselves. And so you can cast that net pretty wide, or you can make that very narrow. Target patient population is critical. So am I trying to address a very narrow focus? Maybe that's Medicaid patients in a specific community. Maybe that is a specific payer mix within a certain type of procedure done at my ASC, and then ensuring that you have the properly formed entity. So you do have to, at the governance level, you do have to have and demonstrate and prove that what you lay out and it state that you're going to accomplish, that you're moving in a way that actually demonstrates that that's your pursuit. You don't actually have to achieve those outcomes. You have to demonstrate that all of your activities for that patient targeted patient population are being pursued. It's called an accountable body, and you're required to actually have one of those set up. If we go to the next slide, the BBE does reduce risk associated with both Stark and AKS safe harbors. So as we think about just some of the regulatory guidance that we have to follow within our ASCs, it is a model that, again, has elevated into consideration of how we work with our providers. If we think about the alignment model and we think back to some of the items that Zach covered associated with the regulations, we do believe that there will be enhanced risk associated with ASCs in the sense of margins that in some ASCs can be small, continuing to shrink if we're not wise in our planning and overall structure. So being really smart about how we prepare and align and look at our overall ASC for potential sale and or positioning should you decide to sell in the future. So if we go to the next slide, actually, let's go to the next slide after that. Some of the important things is how does syndication overall fit? Do I want to be a wholly owned ASC? Do I want to guide really through the physician-led syndication? Do I maybe want to consider a joint venture with a hospital? Or do I want to look at some time of a management overlay? We do have organizations that fall into every one of these categories. So some that have said, hey, I want to kind of get out of the business of managing my ASC. I want to turn that over in total, and they want to pursue a 100% sale. We have others that want to continue to sell equity units to surgeons, looking at raise for capital that may be, Zach covered some of those new procedures when we think about ablations. While those can be lucrative, it's not without a pretty significant capital infusion as well. And then certainly health systems have continued to evaluate their position and how they work with ASC. So if we want to look at shared ownership, access to contracts, there's several different models that allow for that. But being smart about joint venturing with your health system and just laying out kind of the intentional purpose behind that. And then we also have MSO and management overlay. So we do have organizations that have said our goal here isn't really to build equity and maybe they're more regionally focused and they will manage your ASC for a % of revenue or some other type of fixed fee as opposed to you giving up equity. And so I think there certainly are opportunities to evaluate different models. If we go to the next slide, some of the key factors that we think about when we're positioning for a sale is really understanding why you need the capital. So are you having difficulties operating and running your ASC today? Has it not spun off the profits and the income that you expected? Certainly, governance and control, that is quite honestly one of the items that we talk about first and foremost in any syndication is how many board seats do I want? What are some of the reserve powers that are most important to me? So are there certain things that I never want a partner to be able to decide for me, but rather it requires a super majority or some kind of reserved voting authority certainly comes up as we go through these conversations. Looking at ROI and valuation. So what am I looking for from a multiple of EBITDA? Do I even at this point understand what EBITDA is? And making sure that your physicians and your partners are tied in and there's common understanding around those items. Strategic fit. So what does my potential buyer bring? Do they have a mass ASC presence across our community or across our state? Do they have access to payer contracts, which inevitably can be a pretty limiting factor if you do not have access to those contracts, and or if they're not favorable, are they bringing those? Do I have the ability to leverage scale? So maybe on the group purchasing side, or even in physicians that I have performing cases at my ASC. And then really thinking about the compliance guardrails. What is permissible? What do I have the ability to do? Have I met the guidance both from the federal and state government when I'm considering partners? And that's different by state, so it becomes very important to know your state laws and how they fit in. We do still have favorable terms overall in the state of Colorado, but as you expand and as some of these potential partners expand, it will impact them and subsequently you as well. We go to the next slide, really thinking through kind of that decision-making tree. So do I want, is government more favorable to me? Am I in a rural area? Am I in a metro consideration? What are my needs for each of these? And ultimately, what are my long-term goals? So do I have a plan to exit in immediate fashion? Do I want to be out in the next 24 months? Do I have a longer-term consideration, 3, 5, 10 years? And then there's always a consideration for, depending on who your partner is, am I selling a portion or a minority position? Even if it's a majority position, but you're maintaining ownership in that, what are the considerations for future sales, and how does that factor into the syndication? So those are just some of the items that we look at in consideration. When we're thinking about best practices, we can't emphasize this enough. It really is important to prepare. So everything from your financials and how they're structured, what's my overall performance in my ASC? If we look at, and you're saying, hey, I'm just running this for me and a few physicians that I partnered with. We started this 3, 5, 10 years ago, and you may run it differently, and your financials may not be favorable enough for you for a sale. So if you're thinking about a multiple on that EBITDA and you have a very weak EBITDA, obviously that could mean millions of dollars in impact for you if you went to sale before your financials were prepared. Aligning those overall physician incentives. So again, thinking through overall fair market value, how cases are functioning. And again, as you move forward, will you have those same considerations if you have an additional owner or and that can be additional surgeons, it could be PE, it could be hospitals, but thinking through what impact potential sale would have on you. Negotiations on the front end. So what happens with staffing, supply chain, distributions, all items that are very important. What does governance look like overall? I've said that 3 or 4 times now, but being cognizant of those governance changes that may occur and building them into your negotiations. And then what do operations look like after the fact? So do I understand what it means to me if I sell a portion? Maybe my partner wants to grow faster than I want to grow, and thinking through those terms, considerations as you plan for syndication. And then I think communicating throughout. So being aware how this impacts physicians differently across specialties. They may have come to you or they may have set up this ASC themselves based on what they didn't like in another setting. So being smart throughout the negotiations, that you're planning for those items and you can address, that we're just not reverting back to the old setting and now I don't have the say in kind of my day-to-day cases. So those are just some of the best practices that we like to cover. Simon, maybe we open it up for some additional questions that you may have from the chat or from yourself at this time, and we can kind of talk through and field those.
Absolutely. You know, you hit on it more than a couple of times, and I think it's the best place to start. But we've had an inquiry, if you wouldn't mind, to go in a little bit more detail related to specifically the arena that you brought up just before with governance documents and just the application and where it comes into the valuation area. You provide a lot of different context, but if tomorrow our facility was either being shopped for or vice versa, what role does that play, especially knowing how things continue to change on a daily or weekly basis?
Yeah, it's a great question, Simon. I mean, I think that governance overall is one of those areas that you really do need to plan for upfront. How many members do I have? How many members on the board of that ASC will I have going forward? Considerations for if this swells in profitability or my profitability goes down significantly, what areas or what specific reserve powers do I have laid out? And I think on the valuation side, it becomes important to think about considerations around the financial performance, but on the governance side, really critical to think about on a go-forward basis, what does that look like, and what's most important to me as an owner-operator and or someone that practices at that facility.
You know, you when you bring that up, I think about foundation, I think about infrastructure. What you're talking about is the skeleton, right? And making sure that the skeleton is structurally sound so that regardless of what happens, you still have your footing. And that's really what it sounds like.
It really is correct, Simon. So it's also thinking about how future decisions will impact my ability, not just on the governance and financial side, but on the operational side. Yeah. So if my ASC is flooded with different ideas than I had about how my rooms operate, how my patients are communicated to, how distributions are made, all those things will impact overall satisfaction with providers and owner operators. I mean, I think it's a multi-factorial situation.
Absolutely. I want to direct towards Zach real quick because you're bringing up a lot of factors, and Zach talked about data. You brought about a few of those factors, and I guess I wanted to hear your perspective on where data, policy, and operations intersect, and maybe disconnect in that sense. Yeah. Where do you see the biggest disconnect between the ASC leadership goals and the financial operational data being reported? How, Zach, do you see all of those elements playing with one another based on what we just heard about related to governance and thinking 10 years ahead?
Yeah, thanks, Simon. That's a great question. I think when we partner with ASCs and both in the past and present, there sometimes seems to be opportunity to strengthen the tie-in with quality and understanding how that translates. The patients you're seeing today, where are your quality scores at? There's some times where just asking that question from the get-go, you can get a pretty good understanding of where that ASC or organization's at in their kind of data journey. But understanding where you're at today and where the gaps are, because that can translate to your negotiations with payers. It ties into, as more and more regulations are being either changed or added, are you in line with those? But just having that foundational understanding of where you're at today is always kind of the conversation starter I have of how do you know that the level of service and care you're providing is top notch? How do you know that it's in a lower expense setting and ultimately best for the patient and that therefore should be good for you? Those are kind of crucial questions that any ASC, no matter the size, just having just a fundamental, doesn't have to be anything too exciting, a fundamental understanding amongst your leadership team and if that's transparent across the organization. I think that's where I've seen a lot of opportunities in the past, and it's something that as EHRs are coming out with more and more built-in dashboards or built-in canned reports, some of those needs are met, and it's very easy to get to. Other times, it's tying together multiple sources of information and creating your own team template or dashboard to track this. So that would be my 2 cents of where I've seen the opportunity, where I've seen that gap, and just that fundamental understanding that helps an organization get from here to where they want to be in the future.
So Zach, right before you got into the EHR comment, we had a message come through that just said reputation ... I'd love to hear from both of you what that maybe means to you when you hear that after both Zach, your response related to the data, and then Anthony, you bringing in the conversation, talking about, again, the foundation, structure, thinking forward so that the shoulders can carry the weight that may be coming forward, and having the brain size. So obviously that translated somewhere to see somebody respond with reputation ... Whoever wants to start with it.
I'll be a little brief, but and without getting too in the weeds. But I just think of for the ASC space within healthcare, it has been and continues to be a collaborative environment. So whether it's between ASCs and hospitals, whether it's between ASCs and referring providers, that collaboration, I think, ties closely to what your reputation is. And so I think of when you think of all the data that you're collecting, it's one thing to know and feel, or at least think, hey, we're running a top-notch care facility for our patients, and we're really proud of it. But it's another story to communicate that and communicate that effectively. There's a lot of great providers in the state of Colorado that I think that awareness isn't out there, and maybe that reputation lags behind because of it. So that's my two cents.
Yeah, I think it's to add on to that, Simon. I mean, I think it's also this consideration of if we don't have the data, if we're not tracking the data, we're not securing the data, we're not reporting that data, it really limits our ability to communicate our story, which we believe plays an even larger role as we go forward and we think about value-based care agreements and the structure and the positioning for those. So at this point, I wouldn't say ASCs and running them are easy, but I think being able to say, hey, in this setting, it cost $20,000. In this setting, in my setting, in an ASC, it costs $14,000. The cost consideration is one aspect. As more procedures move off the inpatient-only list, move to an ASC setting, now we will be challenged with proving outcomes, proving satisfaction of our patients, proving satisfaction of our physicians and surgeons that are practicing at our sites. All of that, I think, whether it's EHR driven, database driven, and reporting is going to elevate in importance.
So as one last question to kind of sum up a little bit of everything, what's one takeaway for an audience member, just one thing that if they were going to implement tomorrow related to the OBBB and fee schedule impacts, what would you recommend? Because I know a lot of our stuff, especially these last couple questions, were very general, regardless of being in Colorado or Oregon or DC. Regional factors play a role, but a lot of the things you're talking about are much higher level. So what are some specific things for Colorado related to those bills, and will they impact the ability for our industry to continue to grow the way it is?
Yeah, I think you have to have a financial model in place. You have to understand kind of those considerations when you think about the surprise bill considerations, and you think about some of the shifts in reimbursement. I think you've got to be able to report that information out, and you've got to be cognizant of that data reporting considerations.
Zach, any follow-up?
From a straightforward standpoint of with the new procedures that are being proposed for the ASC setting, I think it would benefit any ASC to go through that and just go through almost it doesn't have to be robust and comprehensive, but a checklist of these procedures right off the cuff. What's applicable to the care we provide? What's in alignment and what's not? Again, we're not talking a financial model and projections for each procedure, but just doing a quick, a list, and that starts the conversation. That keeps you prepared for what may be coming in the future rather than reacting to it. And also, you're not quite boiling the ocean by reviewing that list. You're like, here's what, if all of this was, gets signed in and is in effect at this date, here's what we think would make sense for us. And just, starting there would be, my biggest takeaway.
I think of the illusion of you drown trying to drink from a fire hydrant. So
Yeah.
it's a little bit better to take one thing at a time or a few things at a time as you're making your way through. Well, I just want to thank both of you, Zach and Anthony, so much for taking the time today to really educate our audience on what they should be looking for, what they should be doing. We covered a variety of topics, everything from regulatory matters, bringing up some legal elements related to those regulatory matters, the financial elements, what businesses should be doing, and as business owners, they should be thinking about. And I just want to put out there, Zach, Anthony, Curtis, Jana, there's a lot of different folks that we've had the privilege of getting to know from your company, and y'all bring real professionalism and expertise, not only to our webinars that help inform our members, but to our social events, to our conference, which I know we have some participation from your folks in the schedule. So I just wanted to say from myself and from our organization, thank you for your support. Thank you for always being there when we need as an industry to bring that voice of expertise, and especially for our members of the association that utilize your services. We thank you both so much for spending time with us today.
Simon, thanks for having us, and thanks to the organization. I mean, your world's not getting any easier, and appreciate the hard fight you guys are having. So thanks for all your considerations and nice words of the organization as well.
Thank you.
Thank you.
Absolutely. Appreciate both of y'all, and we'll look forward to seeing you in November at our annual conference, which is in Golden at the Marriott Denver West. Between now and then, just a quick announcement, since this will be many members will listen. We have already secured our date for the 2026 Infection Prevention Seminar. We're looking at March 5th at the Embassy Suites in DTC, same location as last year. There will be plenty of marketing going around, but again, can't do these events, even the educational events for our nurses. All of this happens because of support with corporate members and sponsors like Pinnacle Healthcare Consulting. So while you might have educated us today on valuation, regulatory matters, and some of those areas, again, the resources you provide us allow us to put on clinical education as well for infection prevention and SBD professionals. So thank you, and we look forward to hearing from you all soon.
Great. Thanks, Simon. Thanks, everyone.
Thanks, Simon.
Visit AskPHC.com to connect with our leadership team today. If you or your organization would like to learn more about the Colorado Ambulatory Surgery Center Association, please visit their website at coloradoasc.org.